So for the last part of this Women's Health Chit Chat with Dr. Jen, I want to give a special shout out to the last topic of the day, which is menstruation. So dealing with period symptoms is a monthly ritual for approximately 2 billion women out here. But somehow, despite all these collective experiences, we still have so many questions about this whole process. So I have a feeling that we're all too shy and afraid and embarrassed to ask. Yeah, we have come up with so many euphemisms for this whole process. So we've even called it like our period, shark week, ant flow, and some people say my that thing come. What do you call your period? Leave it in the comments down below. Thanks to all the fans who have fearlessly submitted all their questions. Now we can direct them all to Dr. Jen. So one of the question is, I just started working out very recently because of my New Year's resolution, and my period is suddenly very light and lasts for very long. Why is that so, and is it normal?
Yes, okay, so exercise, diet changes, these all lead to hormonal changes, and that definitely does affect your period. Usually we do suggest that you start off slow and you gradually increase it to avoid hormonal fluctuations.
That's very good to know, especially for all the people who start out fast and furious, and then when these kind of symptoms come, they get a bit scared, right?
Correct.
So the second question is, what does it mean if we have periods during ovulation, or let's just say irregular bleeding in between periods? And since ovulation can cause irregular bleeding, when is irregular bleeding a cause for concern?
Okay, so if let's say every month, in the middle of the month, exactly the midpoint, you get 1 or 2 days of spotting, then that's quite normal. That's just ovulation bleeding. But at any other point, I would say it's not normal. And if you are sexually active, I would recommend a pap smear just to make sure that there's no abnormal cells down below.
What could be a reason for abnormal bleeding?
Okay, so it could be cysts, but most of the time what we worry about most is cervical cancer.
One more question from a fan is there any way I can stop having periods completely? I'm not intending to get pregnant anytime soon, and it is very irritating. I feel her, man.
Okay, so there are patients who actually use birth control to skip their periods.
Oh, you can?
Yes, so you just take the packs back to back and don't take the week break to allow yourself to bleed. However, there is a threshold for our body, so some people can do 3 months, some can do 4 months, or some not even 1 month. So it really depends on an individual.
Yeah, because I'm thinking as you take the lining of the...
Correct, it just builds up, and there is a point when the medication can no longer hold up your lining, and then that's when you start to have shedding. It may not be a full-blown period, but you just have this very irritating spotting for many days.
That sounds so bad.
Correct.
And one more from a fan. So what is a normal period? And how do I know if my period is too light or too heavy? Because I've asked my friends, and some of them have heavier periods and some of them have lighter periods.
Okay, so we are all women and we're all different, okay? So I do not suggest that you compare with each other. I mean, yes, you can ask each other, but as long as your period is what you have always been experiencing and the cycle is the same as what you've been having, then that's your normal.
Okay. Thank you so much, Dr. Jen. So hope all those who have watched this video will find that this answers some of your burning questions and put your mind at ease.
Remember that if you have any uncomfortable conditions or you're just curious about your own female health, do reach out to a professional and we can advise you better.
Feel free to leave a comment down below for any other women's health questions so that we can direct them to Dr. Jen.
And remember to subscribe to Medical Channel Asia for more useful health information.
Bye! Bye!
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.